the mayor and the city council announced that there is going to be a capital appropriation imminently of $500 million. $200 million of that is to meet the capital needs of the school system that was significantly damaged in part. $300 million is for our public hospital system. Whether that's the ultimate number, I don't really know, because we are completely focused on getting these hospitals up and running again as quickly as possible. That means that there will be limited opportunity to address some of the repositioning issues that are involved here that are really quite complicated. And we're gonna have to do some of that at a later point, yet we're gonna have to do that with urgency once we get past this initial challenge of getting the hospitals up and running. It will be expensive to replace, not just to replace, but to reposition these systems in facilities that you're running 24/7 and can't just shut down while you're doing the work. But that price tag is likely to be north of $300 million. Obviously, FEMA, a lot of this is FEMA reimbursable. I understand that Senators Schumer and Gillibrand are both working on getting a congressional appropriation together with their colleagues to help the storm-ravaged areas, to fill in some of that gap, that FEMA gap between 75% and 100%. There's also significant revenue loss here. There's an 1135 waiver that has been submitted to the federal government to try and cover at least a modest portion of that, but it is an expensive proposition, and the costs here are quite enormous. We're going to go forward assuming that this can happen again next year when we hit the next hurricane season, and that's going to require an enormous amount of work to reposition systems and to harden our facilities to make sure that we can get through this the next time without going through as much turmoil as we have this time.